Hi everybody, my name is Lokanc-Diluzio, and the title of this presentation is Using Theory to Guide Sexual Health Promotion. What's ahead? First of all, I will discuss what is theory, why is it important. I will discuss the information, motivation, behavioral skills model, as well as the application of the information, motivation, behavioral skills model. I will also discuss the population health promotion model, as well as application of that model. So what is a theory? A theory is a set of ideas or concepts that are used to explain a set of observed facts. So a question for you to think about is, what theories do you use to guide your practice, your studies, your research? How can they be applied to the understanding of human sexuality? Do you use theories? I think a lot of people, and myself included, before I went into the academic side of things, I didn't realize I was using theory, but I was using theory, and that might be the same for you as well, that you do use theory, but you just can't put a name to it. Why are theories and models important? A basic knowledge of some theories and models can be useful as we examine topics such as sexuality education, health promotion, gender roles, relationships, and sexual behaviors. By considering theoretical approaches, studying human sexuality goes beyond the compilation of random observations. Theory helps us to organize observations into meaningful conceptual frameworks that provide possible explanations for why and how those patterns of sexual behavior occur. And it's important to note that no single theory can explain all aspects of something as varied and complex as human sexuality. The Information, Motivation, Behavioral Skills Model, also known as the IMB model, was developed by Fisher and Fisher in the early 1990s as a way to explain HIV preventative behaviors. They proposed that three constructs, information, motivation, and behavioral skills, interact to predict health behavior. In other words, people need accurate knowledge, the personal and social motivation to act, and the actual skills to carry out those behaviors effectively. Information refers to actual or accurate knowledge about sexual health as well as prevention methods. Motivation includes both personal attitudes and perceived social norms that support protective behaviors. And behavioral skills are the concrete abilities and confidence required to actually perform those behaviors. Together, these three interact to influence behavior. The IMB model helps researchers design studies by pointing to the key factors that drive behavior. It allows us to identify whether a lack of information, low motivation, or weak behavioral skills are the main barriers. This structured approach makes it easier to design interventions that target the right mechanisms of change. In terms of applying the model, consider that a low-income 16-year-old sexually active female can lower their risk of sexually transmitted and blood-borne infections and pregnancy by using condoms. So information would be age and developmental appropriate information regarding what a condom is, how to use a condom correctly, where to access free or low-cost condoms. May also need some basic information regarding anatomy and physiology, as well as sexually transmitted and blood-borne infections, as well as pregnancy. In terms of motivation, we want to think about personal motivation, emotional motivation, as well as social motivation. So positive personal motivation might be belief in condoms, that they will prevent STBBIs. A negative personal motivation would be a belief that condoms would take spontaneity out of intercourse and will detract from sexual pleasure. the person may secretly want to get pregnant as well. That could be a negative personal motivation. A positive emotional motivation would be feeling good about preventing STBBIs as well as pregnancy. Negative emotional motivation would be feeling embarrassed to access condoms or being afraid to speak with a partner about using condoms. Positive social motivation, there might be supportive peers around that use condoms, so it might be socially normal to use condoms, whereas a negative social motivation might be that the partner doesn't like using them, or none of the friend group uses them. In terms of behavior skills, this may include developing the skills through applying the knowledge of where to access the condoms. So actually going to the store and looking at, where they're kept, where what shelf, what aisle, and then applying the knowledge of how to use the condom. So practicing opening the package, practicing putting one on correctly. And practicing how to broach the topic with the partner and practicing condom negotiation. This model has several strengths as well as limitations. So some strengths might be that it's simple, practical, flexible. There's strong empirical support. A lot of studies have used this model to guide their research. Applicable across populations and contexts, whereas limitations are that it may be, oversimplifying complex influences. It requires cultural adaptation, and it works best when combined with context-specific analysis. Another model that I use regularly, which is why I'm showing it and presenting it, is just to show you that, we actually do use these models in our practice. But one that I commonly use is the population health promotion model. The overall goal of the population health promotion model is to improve the health of the population through a comprehensive approach. Population health is an approach that addresses the entire range of factors that determine health, and by doing so affects the health of the entire population. Health promotion is commonly defined as a process for enabling people to take control over and improve their health. Population health promotion explains the relationship between population health and health promotion. So what makes people healthier? What determines health? So on this population health promotion model, on one side of the cube are the determinants of health. And so I think, as I go through this, I'm just going to go through it very quickly because I think that it is probably common sense to everybody. So I don't want to, speak too much about something that you already know about. But income and social status, research shows it's not the amount of wealth necessarily that impacts health, but it's the relative distribution, which is the key factor that determines health status. So in areas where there's a large variability between the rich and the poor is usually where there's huge differences in terms of health. Likewise, social status affects health by determining the degree of control people have over life circumstances and hence their capacity to take action. So, an example might be, single parent families or teen parents, might have lower income, and that in turn impacts health. Social support networks, social or support from families, friends, and communities is important in helping people deal with difficult situations and maintaining a sense of mastery over life circumstances. Informal support, so, friendships and just, people you hang out with, like people even from work or peers is important, as well as formal support networks where people might actually go to a support group, where there's somebody that's being paid to facilitate. And then, there's societal support for actions as well. Education is another determinant of health, and that is meaningful and relevant, um, or education that's meaningful and relevant equips people with knowledge and skills for daily living, enables people to participate in their community, and increases opportunities for employment. And as you know, in developing countries, there might not be as many opportunities for education, and that has a huge impact on health. Working conditions also impacts health. So, meaningful employment, economic stability, and a healthy work environment are associated with good health. Having the ability to go on maternity or paternity leave, having flexible, child-friendly employment, as well as healthy work environments will impact health. I'm not sure about you, but I know for myself as a nurse during COVID, where I was redeployed into swabbing and vaccinating. That was a very stressful and at times unhealthy work environment, and a lot of people were sick just from emotional burnout. Physical environments, factors such as air and water quality, the type of housing, and safety of our communities have a major impact on health. So our neighborhoods, the amount of green space, paths, if the area is well lit, bus routes have an impact on the health of people in the community. Biology and genetics, biological sciences has shed light on, physiological makeup as an important determinant of health. So nature versus nurture, having family histories or a genetic predisposition for cancer or, autoimmune disease or illness is obviously something that impacts health as well. In terms of sexuality, the next determinant of health, personal health practices and coping skills, seems to be an important one. So personal health practices are key in preventing diseases and promoting self-care. Just as important are people's coping skills, effective coping enabling people to be self-sufficient or self-reliant, solve problems, and make choices that enhance health. Healthy lifestyles or lifestyles that promote health will help a person stay healthy, whereas if you have a stressful life and you deal with it in terms of using substances, that of course will impact your health as well. Healthy childhood development. Positive prenatal and early childhood experiences have a significant effect on the subsequent health of children. Healthy pregnancies are important. We know that people that have pregnancies, where there's a lot of issues and a lot of health problems, there ends up being problems early in life as well. There's the importance of the continuity of pre, anti, and postnatal care. Vaccinations are important. And then, in terms of young children, stress or toxic stress at an early age have a huge impact on health as an adult. Health services, there's a relationship between the availability of preventative and primary care services and improved health. So, for example, well baby and vaccination clinics, education programs about healthy choices, as well, rural, the difference between rural and urban, oftentimes there isn't health services available in our rural populations. It's important that health services are accessible, appropriate, affordable, as well as collaborative. Gender, we know that, men and women suffer from different types of health and social issues at different ages and stages. There's income disparities between, identifying, or people that identify as men, women, women, or other genders. In terms of culture, our customs and traditions and the beliefs of family and community all affect health. The way we parent, immigrants oftentimes have different beliefs about accessing health services. And then, of course, considering our Indigenous people that, have gone through a lot of trauma throughout history, that will impact their health today. So the traditional 10 tips for better health. Number 1, don't smoke. If you can, stop. If you can't, cut down. Number 2, follow a balanced diet with plenty of fruits and vegetables. 3, keep physically active. 4, manage stress by, for example, talking things through and making time to relax. 5, if you drink alcohol, do so in moderation. 6, cover up in the sun and protect children from sunburn. 7, practice safer sex. 8, take up cancer screening opportunities. 9, be safe on the roads, follow the highway code. 10, learn the first aid ABCs, airway, breathing, circulation. The social determinants, 10 tips for better health. Number 1, don't be poor. If you can, stop. If you can't, try not to be poor for too long. 2, don't have poor parents. 3, own a car. 4, don't work in a stressful, low-paid manual job. 5, don't live in damp, low-quality housing. 6, be able to afford to go on a foreign holiday and sunbathe. 7, practice not losing your job and don't become unemployed. 8, take up all benefits you're entitled to if you're unemployed, retired, or sick or disabled. Number 9, don't live next to a busy major road or near a polluting factory. And 10, learn how to fill in the complex housing benefit application forms before you become homeless and destitute. So how do we improve health? According to this model, it's through 5 health promotion strategies as defined by the Ottawa Charter for Health Promotion. So building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. In terms of building healthy public policy, you want to do that to ensure that policy developed by all sectors contributes to health promoting conditions, so healthier choices of goods and services. A good example of this is, the laws with cigarette smoking and it being banned from public spaces. Other examples would be syphilis and HIV testing during pregnancy, neonatal eye drops, blood screening. Those are all examples of healthy public policy. In terms of creating supportive environments, we're looking at physical, social, economic, cultural, and spiritual environments. And this recognizes that rapidly changing nature of society, particularly in the areas of technology and the organization of work, and that ensure positive impacts on the health of people. So, for example, supportive environments might be school-based education types of programs or interventions. I will be providing an example at the end of a school-based project that I was involved with, healthy pregnancy programs, social marketing campaigns, and the whole idea is that you want the healthiest choice to be the easiest choice. So, an example would be, eliminating junk food from vending machines, you want to create an environment that promotes healthy eating, then make sure you put healthy food in canteens at school. In terms of strengthening community action, you want to do that so that communities have the capacity to set priorities and make decisions on issues that affect their health. So you want to involve the community members. You want to have intergenerational types of programs as well. So you have, young people, older people involved, and not just tokenistic involvement where, as a health professional, we want somebody on a committee so we can say we involved them. This is about meaningful involvement so that people can actually decide, the interventions and the programs and the types of things that will help benefit them the most. Developing personal skills. We want to do that to enable people to have the knowledge and skills to meet life's challenges and to contribute to society. So, having health education opportunities, having, teachers or health professionals talk to, school-age children about proper hygiene and hand washing, perhaps talk to them about, making healthy food choices and being physically active. Developing personal skills is also important in terms of professional development and continuing education, so that as health professionals, we are able to practice from the most current and up-to-date evidence-informed body of knowledge. Sometimes, we need to reorient health services so that we create systems which focus on the needs of the whole person and invite a true partnership among the providers and users of the services. So, a really good example of reorienting health services was, during COVID, where we moved a lot of our, screening services or even, education services to tele or virtual health because people weren't able to come to a public area in fear of getting a virus or spreading it. So, we learned that you can do a lot of virtual health, and in turn that ended up saving the healthcare system a lot of money as well. The top side of the cube is the level of action. So who do we promote health with? You can promote health at an individual, family, community, sector, or system level, or even a societal level. And then at the bottom is the importance of evidence-based decision-making. So why do we act? Well, we act because we have research which guides our practice. We act because of experiential learning, as well as because of quality improvement, quality assurance, actions, evaluation, things like that. So in terms of the application of the population health promotion model, several years ago when I worked as a sexual and reproductive health specialist, a principal called my program and said that the sexual health was an issue at this particular high school and wanted my program to come in and fix the problem. So as a person that, uses the population health promotion model, I knew that I could not just go in there and fix the problem. The first thing that we needed to do was just gather more information, to ensure the school community indeed thought there were issues to address. We wanted to know if the school thought, sexuality was an issue, or if it was just the principal that thought sexuality was an issue. So the first thing we did was we gathered evidence. We conducted 6 focus groups, which, and we also conducted 98 student surveys and 8 parent surveys. We also reviewed literature and statistics on teen sexual health. And, this was in Calgary, so we focused on, Calgary data. I won't go into a lot of detail here, but through the focus groups, surveys, and as well as the literature and some of the local data we had, Calgary-based information, we learned that sexually transmitted and bloodborne infections, as well as unplanned pregnancy, was an issue within the general, high school teen population. At this particular school, there was also, issues with dating relationships, having unplanned intercourse, being in a social environment where there was where a lot of friend groups were sexually active, so it felt that everybody was sexually active. Contraception was an issue in that not everybody used it. It was indicated that people lacked knowledge and skills when it came to sexual health. And then there was, this sense of, it won't happen to me. So, that cognitive egocentrism where people don't necessarily, make the healthiest decisions because they don't think that there's going to be harm coming to them, that it might happen to someone else, but not to them. So, they sometimes wouldn't use condoms or other forms of protection. But something that really came out a lot in the focus groups as well as the surveys was, just the use of alcohol and how it impacted sexual decision making, because a lot of, youth in high school, that's the time where they start experimenting and, not knowing how to handle the alcohol and then making, decisions they may have not made if they were sober. Some people also said that alcohol was used as an excuse, or it was used as liquid courage, to give them courage to experiment and do things that they normally wouldn't do. So what we did was we ended up forming a committee. So that would be the how. We strengthened community action. So we had a committee consisting of students, a teacher, a nurse, as well as myself, the sexual health specialist at the time. And we decided what the topic was related to sexual health that we wanted to address and how we were going to go about addressing it. We also decided on the level of action, so the who. So we decided that it would be the school community, students and parents, particularly students in grade 12. And then we decided on the determinant of health to address. So the what? So we were looking at personal health practices and coping skills. The committee really wanted to focus on education. So what we did was, the committee decided to focus on the topic of alcohol use and sexual decision making. Over the course of 2 to 3 years, we developed, implemented, and evaluated several interventions. Many of these interventions were then offered to other high schools. So it was kind of, developed as a focus tested or like as a prototype at this high school, and then it was rolled out throughout the city. We ended up creating lesson plans on substance use and sexual decision making, and then our sexual health educators ended up going into several comm classes to teach the lessons. We also delivered parent education sessions. We wrote a proposal and received funding to develop professional looking, display materials like pamphlets, posters. Also wrote a proposal to and received funding to develop a Smart Grad resource kit, which targeted the grade 12 students, which included, a whole display material as well as a game for nurses or educators or teachers to use with their students. So I hope that this presentation sheds some light about how you can use theory to help guide, sexual health education and programming. So now I just want you to think and reflect, what what was the most important concept I learned this module? So what? This is important because now what? 2 things I need to explore further.